Hello, and welcome to Rochelle, the Hemorrhagic Stroke survivor. This is the second video in the stroke series, and today we are going to talk about intracerebral hemorrhage or hemorrhagic stroke. Remember last time I told you a stroke is a sudden interruption of the blood supply to the brain. So we will talk about how a hemorrhagic stroke happens. Another name for hemorrhagic stroke is a cerebral bleed. What is a intracerebral bleed? This type of bleed happens in the brain tissue or the ventricles. This is when a diseased blood vessel suddenly bursts, all the blood leak in the brain. The pressure within the brain causes damage to the brain cells. This sudden build-up of blood can cause unconsciousness or death. Symptoms of hemorrhagic stroke. Symptoms occur when the person is awake, and it appears to happen without any warning, but it will develop over a period of 20 to 30 minutes. Certain symptoms of this stroke are headaches, seizures, one-sided weakness, some signs of decreased level of consciousness, vomiting, neck stiffness, and coma. With me, none of this happened before the stroke. It just came on just like that. But in an hour, I had some of these symptoms. Causes. Some causes of this hemorrhagic stroke are aneurysms, brain trauma, malformations. This is the connection between the veins and the arteries, and brain tumors. Some other risk factors can include low cholesterol, cocaine use, blood thinners, and alcoholism. But the largest risk of these bleeds are spontaneous bleeding or through amyloidosis, which is a group of diseases in which abnormal proteins build up in the tissue, or high blood pressure, which is the leading cause of having a hemorrhagic stroke. To diagnose this type of stroke, a CT scan is required. Short or permanent damage. Damage to the brain directly can cause weakness or paralysis of an arm or leg or both. trouble speaking, confusion, facial droop, difficulty in understanding language, vision problems, hearing problems, seizures. Treatment. Swift treatment should be carried out in an intensive care unit. Surgery is used to place a ventricle drain or to remove the blood. This is useful in certain cases. I didn't have any surgery because the blood was too deep in my brain, so they said that it was too risky to have the surgery. Life of survivors. A hemorrhagic stroke is life-threatening, and many deaths occur within the first 2 days. For those that have survived, recovery is very slow. A small amount of these persons are able to recover functions completely, near completely, within 30 days of the stroke. Others, years, or some live with the permanent loss of functions. Prevention. There are ways to help prevent you from having a hemorrhagic stroke. Exercise and controlling your high blood pressure are two of the most important ways. Educating yourself about the effects of prescribed drugs and the food you are eating. If your cholesterol is high, getting treatment is a must. Also avoid alcohol or excessive alcohol, illegal drugs, and smoking. All of this can help fight off your chances of having a hemorrhagic stroke. You can check out websites, books, or magazines for more information on hemorrhagic stroke. So see you next time when we will talk about ischemic strokes.